Welcome. I'm Sharon Switzer-McIntyre, and I'm on faculty here in the Department of Physical Therapy. I am a physical therapist. In fact, I'm a passionate physical therapist. I can't imagine a role outside of rehab. Sometimes they confuse me with an OT because my area of practice is in the occupational health and occupational disease area now. But I've had a long journey through hospital-based physio, to owning my own private practices, traveling with national teams. One of my teams was the Canadian rugby team, so I've got lots of interesting stories to tell. And then I put athletes in for workers and worked in the occupational health area, and now do research specifically in the area of occupational disease and hand-arm vibration syndrome and contact dermatitis. So, you know, a little bit of a niche corner of the market, but very exciting indeed. So thank you for coming today. I'm going to walk you through the PT program, which mirrors in many ways some of the OT presentations. So you'll hear a few things again, but I'm going to talk to you about it in the context of the PT program. We are recording this so that we can post it, so that for those who could not make it, they can visit our website and get the information, but none of you will be in the recording or in any way, shape, or form identified in the recording, just so you know that. Okay. So again, I will talk about the program. Daniela, who really is the nuts and bolts and runs the show, will talk to you about some of the admission information, and then I believe folks have signed up for tours where you get an opportunity to talk to students who are in the program. So those are where you can really ask the questions and get the answers that you want to get. So do take advantage of that opportunity. So what is physical therapy? Physical therapy is a self-regulated healthcare profession. We are under the Regulated Health Professions Act, which means we are an autonomous practitioner, and therefore people do not require a referral to come to see us, a medical note for the most part. If you're working in a hospital environment because of the Hospital Act, there's a referral that's required, but as a clinician, working in the healthcare environment, we are completely autonomous and do not require doctor referrals for treatment. And the focus of physio is really towards the promotion of movement, of function. We do part of our scope and part of our protected act is the capacity and the ability to diagnose, which is very select for very few healthcare professionals. PT happens to be one of those healthcare professionals where we can diagnose within our scope. And then, of course, we treat patients of all different shapes, sizes, and dysfunctions that I'll talk about in a minute. The primary tools of the trade, if you will, for physical therapy are exercise, various electrotherapeutic modalities. We do a lot of education, a lot of consultation. Really, as I said, with that whole focus to restore function. And it's completely focused on patient goals. So what does the patient want to be able to do? What does the patient need to be able to do to achieve their optimal levels of function? Which may not always be to be completely better again, because that might not be a realistic goal. So how do we help them get to and achieve their goals? Where do we practice physical therapy? It's broad, it's across the spectrum, it's very much like OT. We go from acute care through to chronic care. We are in rehabilitation, long-term care facilities. We do private practice in sports. We're in industry. Some of my own private clinics that I had were clinics within private industry. So Ontario Hydro, Northern Telecom, Bell Canada, those kinds of organizations where I work directly with the workers in their workplace, which was fun. We work across the lifespan from children, pediatrics, through to geriatrics, and we work across all systems. So the musculoskeletal system, the cardiorespiratory system, the neurological system, and more, the patients we see have multiple morbidities. So you never have one system that's down, you usually have multiple systems that are down. You never have one problem, you usually have multiple problems, which is what makes the profession of physical therapy so much fun, because it's always an ongoing quest to determine what the problems are, what the underlying problems are, what kinds of strategies can you put in place to help restore the function to its optimal level? We also work in the health promotion domain. So a lot of physios work in health education, in smoking cessation programs, in obesity reduction programs, all sorts of various programs across the spectrum of healthcare, and in family healthcare teams. The physical therapists are one of the key players in a family healthcare team now as well. Like OT, we also have a roles and competencies. They're rooted mainly through the CanMeds rules. So physicians, physios, OTs, nurses all have roles that we identify and structure our curriculums and our professional practices around, where we are expected to develop competencies in being a professional, in being a good communicator, in being a collaborator, a manager. And that doesn't mean management of a clinic. That means management overall of ourselves and our patients and our healthcare interactions. An advocate for our patients, an advocate for our profession, an advocate for healthcare in general, and scholarly practitioners. We're all expected to be evidence-based practitioners and really look at and think about what's the best available evidence as we interact and treat our patients. And how do we contribute to the development of the evidence that drives our practice? And that doesn't mean that we all have to be high-powered researchers. We're all researchers every single day that we are in clinical practice. And then the center of it is our expert physical therapy knowledge. That's what that expert piece entails. So this map is the way we structure our curriculum. It's the way we structure our profession, and it's used across the country. So it's something that we have adopted professionally in everything that we do. So a career in physical therapy can take many, many, many different types of avenues. I've been all of these. So a clinician where we're working directly with patients, delivering care across a variety of settings. A researcher where we're conducting research. An administrator where we're owning clinics or we're working in administrative roles within some of our healthcare organizations. An educator where we're educating patients and families and members of the public, working in school settings. Health promotion and health prevention where we're working to promote healthy lifestyles. An advocate, not only just at the patient level, but at the healthcare health policy level. There are a number of physios who work at health policy types of job opportunities with the Canadian Institute of Health Information, with the government. There are all sorts of different venues in that domain. And then as a consultant. And there's, again, it's wide open what you could be consulting in. You could be consulting to employers with respect to healthy work environments. You could be consulting with lawyers with respect to return to work processes and practices and disability management. You could be consulting again with the government and health policy issues, with insurers with respect to policies that insurers develop and implement regarding the delivery of care. So the scope and the breadth and the depth is unparalleled, really. The job trends for physical therapists, we have 100% employment rate with all of our graduates. The profile of what kinds of jobs are out there, again, is endless. And we have we just had convocation last Wednesday, so I got a chance to talk to lots of our new grads who are looking at their job profiles. Some of them are mixing and matching a little bit of a private sector job and a public sector job, so they're working in a private practice setting, and they're working in an acute care hospital setting because they want that confluence of the private practice, more independent patient, and the more acutely ill patient in a hospital setting. They are one's working as a health advocate in a family health team, so there's all sorts of different opportunities out there, but our employment rate is 100%. We have, well, I guess we've really covered all these. There's multiple employment positions, and there's an opportunity for international employment. We've got 2 or 3 of our new grads who are heading off to do work abroad, which is also very exciting. Salaries vary depending on your years of experience and whether you're in a public versus a private sector, whether you're in a unionized environment versus a non-unionized environment. But the starting range is usually between $50,000 and $60,000. So how do you become a physical therapist? All Canadian PT schools, so everybody across the country, requires a degree because we are a master's entry-level to practice program, so that's across the entire country. You must graduate from an accredited physical therapy school in order to be eligible to challenge the licensure exams. And we have a 2-stage national licensure exam. We have a theoretical exam, which is 200 multiple choice questions, which is a 4-hour exam that's run 6 times a year. And we have a OSCE-based clinical exam, which is a full-day grueling exam, which just happened on Sunday. And there have been a couple of our recent examies wandering around the halls today going, oh my gosh, Sharon, that was a long day. So there's a final licensure exam, which is a practically based exam. And then you must register with a provincial regulatory body. So depending upon where you're going to practice in the country, there is a provincial regulatory body for that particular province. But you must be registered in order to practice. So why U of T? Number one, as Andrea has commented already, we sit in this incredibly rich clinical environment where we have world experts across the street who come in to teach you with respect to their areas of expertise. They then become your peers and your colleagues, where you can pick up the phone and call them and ask them about clinical questions as you're out there in your clinical practices and are approached by a patient where you're going, I'm not quite sure what I would need to do with this particular problem. You've got resources that extend beyond your 2 years that you're here, which are incredibly rich and incredibly important to you and your practice and to us as a profession. We use a very diverse teaching model and learning model here, where we do a combination of small group learning, of independent learning, self-based learning, reverse classrooms, obviously some didactic-based learning as well. And we spend a lot of time in our clinical skills labs working on the clinical acquisition of skills. We have breadth and depth in our core faculty. We go from health policy experts through to experts in specific clinical areas. So we do kind of qualitative research through to quantitative research with our core tenure stream faculty, who all have numerous awards, both in their clinical worlds and in their research worlds. We have over 200 clinical teaching facilities that we work with, including many located in downtown Toronto, but we go from the Lake to Barrie, from Oakville out to Newmarket as well. So a large clinical area that we draw from, so you get that urban and that rural type of exposure to your clinical learning opportunities. And of course, you have access to all of the U of T resources that Andrea spoke of. We have a world-renowned library, we have computer access here. We also have a full simulation lab, which we use for some of our clinical teaching here in the PT department as well. So the curriculum for the PT program, again, a 2-year program, 2 years intensive. You hit the ground running on the first day and you really don't stop until 24 months later. We start with an intro to the profession and a focus on our cardiorespiratory rehab. We then move into an introduction to the musculoskeletal system, which embedded in that is a 3-week clinical internship. You then go out into a clinical internship where you get to practice some of your skills in either a musculoskeletal or a cardiorespiratory environment. You come back to into the program and work on your develop skills in the neurological rehab area and start your research projects, which is a 1-year research project that you do. And then you go back out for 10 weeks in the clinical environment, come back and do some advanced musculoskeletal, finish off your research, and finish with a clinical internship of your choice. Within the program, there are some streams and some themes that run with respect to the profession, professional aspects, advocacy, business and resource management, some healthcare delivery system pieces, and workplace health and pain, which is a big focus within our profession, because that's often what people come to see us about. Their initial complaint is that I hurt somewhere or I can't move something. Yep. Right. The research projects are group projects, where faculty and clinical researchers submit projects. And in fact, I think I have a slide on it, but I'll talk about it now. Faculty and our clinical researchers submit projects. The students get an opportunity to ballot for those projects, and then you work in groups of 3 to 5 on a particular research project. And in fact, here at the University of Toronto, we have a publication rate that is absolutely national and international standard, where our publication uptake of our student research projects is over 65%. So many of the research projects are going on to publication to contribute to that scholarly practitioner developing the evidence in the research. So the U of T curriculum really does challenge our students to engage in some systematic inquiry, to formulate your thinking around a clinical reasoning, clinical framework. It fosters that critical thinking. We really push you to continue to ask that question, why? What's underneath this? Where are we going with this issue? It enhances some of your moral reasoning, so really to put the patient in the center of everything that we do and we think about. We're constantly encouraging problem solving and really nurturing that integration of theory with practice. So you spend time here at 500 University Avenue, and then you spend time out in the clinic where you're really blending those two and working collaboratively with our status only and our clinical faculty and our kind of in-house core faculty. From the research perspective, I already talked about this. We have the highest publication rate across the country. Some of the examples of some of the research projects that students have done recently is one on preoperative rehabilitation needs assessment for total knee arthroplasty. So what are the needs of individuals before they actually have their surgery in an area that we call prehab, which is really critically important for us to understand what functional level should we have people at in order to post-operatively them have the best results. So thinking about it from that perspective, understanding essential competencies for Canadian PTs working in resource-poor countries. So what kinds of competencies do PTs do we need to have in order to make sure that we can be the best that we can be and address the needs of the individuals in resource-poor countries? And then a little bit of a bias. Workplace injuries in Canadian physiotherapists was one of my projects, where we looked at what kinds of injuries do PTs incur in the workplace, and how good are we at actually reporting those injuries. And I can tell you, we're not that good at it, because we all think we can treat ourselves. Clinical education is another one of our very important aspects of our program, where we have over 200 clinical sites that we access for clinical internships. As I said, our geographic catchment area is from Oakville to Ajax, Pickering, Barrie, and the Lake. And we also have opportunities for individuals to go what we call out of catchment, so beyond the borders of our boundaries to across Ontario, across Canada, and we always have students who also go internationally. And again, that scope is huge. The sites are divided really into 6 categories that we think about. So we have our acute hospitals, many of them right along this border. I'll get to you in a minute, okay? We have rehabilitation centers, long-term care facilities. We have pediatric centers, hospital for sick children being literally across the road. We have a number of private practice outpatient facilities, community services, and we also have opportunities for clinical internships for those who are interested in administrative roles within some of our professional associations and in some of our larger teaching hospitals where our physios also take on administrative roles. So if you want some of that role modeling, there's an opportunity for that as well. And it's a sample of some of our sites, and there's a full list of our sites on our website. And I can honestly say that student life and beyond is something that happens within this program, not only because you get thrown into a room, and it's this room on day one with 90 students, 90 people that 99% of them you don't know, and 24 hours later you're up in the clinical skills lab, essentially stripping down to your bra and underpants or bra and shorts. So we get to know each other really quickly, and that bond I can see as a graduate of this program who just had my class reunion that was many years, not long ago, where that bond stays very strong. The people that you go through your program with are your peers, your colleagues, the individuals that you pick up and call when you have a clinical question or where you want to refer a patient on. So that piece of student life becomes a strong, strong bond. And I can say the students, like the OT students, and actually the PT students and the OT students play a lot together, is very strong. The PT students also tend to be the ones who win all the intramural awards. We've done very well in our intramural opportunities lately. I'm going to pass it over to Daniela, but you had a question. It depends on the year, and it depends on where they want to go, and it depends on what's going on in the world. So there are opportunities for sure. Yeah. I don't know. I mean, it's hard to say what's a lot, but there are opportunities for sure.
Thank you. Okay. Hi, I'm Daniela. I'm the registrar and the admissions officer here in the Department of Physical Therapy. So at the end of the presentation, if you have a really complicated question and you're interested in the PT program, I'm the person that you want to talk to. Okay, so a lot of this is similar to what Aleem already touched on, but I'm going to go over it again because we are posting this presentation online for people who couldn't make it because we did fill up today. So for the academic assessment portion of the application, we require a bachelor's degree with high academic standing from a recognized university. As Aleem mentioned, oftentimes a fine art degree or a theological degree doesn't necessarily have the 75% liberal arts and science requirement that our School of Graduate Studies has. But most other degrees are fine. And if you're not sure, just come and chat with Aleem and I afterwards. So we look at the last 20 half credits, and competitive GPAs between an A- and an A. PT employs an exact cutoff. It is based on the applicant pool, and this past year it was a 3.8. I don't know what it will be this year because it's based on the applicant pool, and I won't have those applications until February, but I do have the last 6 years of data on our website, and if you take a look at that chart, the GPA cutoff has been trending upwards. And we also require prerequisite courses, which I'm going to talk about right here. So these are the prerequisite courses we require. It's a total of 7 one-semester courses. You do need to have at least a 70 or a B- as per the grade on your transcript. And if you go to this page on our website right here, you can actually verify your exact physiology, anatomy, and stats course. I have over 50 Canadian universities listed here, and you can go on the website and you can make sure that the exact course that you took is already approved. If you have a course that isn't on the list and you think it should be, there's also instructions on how to email. You're going to be emailing me with those details, and if we review it and we agree with you, then we'll add it to the list. So for the non-academic assessment portion of the application, we require 2 references, an academic reference, which could be a professor or a TA. We do not require that they be tenure stream, but it is one set of references if you're applying to multiple schools and programs. So I would just say, like, say you're applying to here in Western and Queens, I would double check what their requirements are because I'm not sure if they have different requirements. But for us, a professor or TA, those are the most commonly used references. And for the professional reference, again, mostly employers or volunteer supervisors. They don't have to be in the healthcare field. We just want to see, does that person think that you're going to be a strong healthcare professional? So, how do you work on a team? What are your communication skills? These are things that you can demonstrate in lots of different things. It doesn't have to be healthcare specific. So we do a second stage part of our application process. So we call it the CAP. It stands for Computer Administered Profile. It's basically a written test. It's very similar to an interview. You come on site to do the exam. You're asked a set of questions. They are similar questions to what you would see in an interview. It's just you're going to be writing your responses instead of verbally saying them to someone. We may ask you to give an example of something that you've done. We may give you a situation and ask how would you respond in that situation. And we do expect that you have an understanding of the profession. That doesn't mean that we expect you to know how to fix, a sprained ankle, but we do expect that you know about the profession and maybe some trends in the healthcare field. So how is GPA calculated? We look at your last 20 half credits completed by December 31st of this year if you're applying for the current cycle. Summer courses with grades are included. And the one thing to remember is that if ORPAS has to go back into a previous academic year for even one course, it's going to be a weighted average of the entire year, fall and winter courses. I'm going to go over a little example. So most people apply when they're in their 4th year of study, and say by December 31st you will have completed 15 half credits throughout 3rd and 4th year. So your question is, what courses are going to be used from 2nd year? So we're going to count the 15 half courses from 3rd year and the fall term of 4th year, plus we will take the average from your entire 2nd year, fall and winter, and use that average 5 times. So here's just a chart so you can see it visually. So say you had a 3.54 in 2nd year. In this example, it would be like, so your 5 courses from your 4th year fall term, all 10 from your 3rd year, and then it would be like you got 3.54 5 times, and that gets added into your average. We can go over that if you have a specific question, but does that generally make sense to people? Okay, I see nodding heads, so I'm going to keep going, but like I said, you can come and ask Aleem and I if you have a specific question. This is the same table that Aleem posted. It's available on our website, and it's available on the ORPAS website. And the most commonly used scales are 3 and 7, but basically you just have to find where your school is on here, and you find the corresponding scale. You do need to convert every single grade within the last 20 into a number on this, into a number on the 4.0 scale. You cannot take, say, your U of T percentage average and just convert that. It does not work like that. You have to convert every single class and then take the average from there. And that's how ORPAS does it for all the schools. And just one thing I should mention that in the PT department, we do count graduate marks. We do a manual recalculation here in the department. So if you do have a master's or you have some other graduate level work, we will recalculate your GPA to include that. So our program is also very competitive. We had about 1,100 applications this past cycle it's about 90 spots. The GPA cutoff was a 3.8. People always ask me what was the average of the GPA of the incoming class. That is available on our website. Of course, it's a little bit higher than what our cutoff is, but we do have people who get into the program who are at the cutoff. So yeah, if you're close, then you should definitely apply. So this is a snapshot of what our incoming class that just started in September. Very similar to OT. A lot of people come in with some sort of science background. I think a lot of these Bachelor of Science degrees, they are Bachelor of Science in Kinesiology, or some students actually have a Bachelor of Kinesiology. So I think a lot of people who come in from those fields are naturally interested in the healthcare professions. But we don't do any sort of ranking based on degrees. So if you do have a Bachelor of Arts, as long as you have our prerequisites, then you would be eligible to apply, and you would not be at a disadvantage in the application process. It might be a little bit more challenging for you starting the program in September. There might be some, it's like a different language, right? Like the science world it can be very different from the arts world, but as long as you're willing to, put in some extra work that you potentially might have to do, then you can definitely do it. This is very similar to what Aleem already talked about, so you should really know your financial needs. If you are living downtown with a roommate and you're paying tuition, it's between $25,000 to $26,000 a year, and that's an average. So I see people who spend even more than that. I see people who maybe are commuters and they live with their parents and they commute in and they spend less. But it's an average, and we just really encourage you to have a financial plan in place before you start the program. As Aleem said, costs associated with your placements are your responsibility, and placements are not paid positions. And availability of scholarships and bursaries for students in all professional programs is relatively limited. In the PT department, we do not have any entrance scholarships. There is one award, the Ontario Graduate Scholarship, which is eligible. Prospective students are eligible to apply, and you can find that information on our website. And we do have some bursaries for students who are in the program. And I would always share that information with you over email. So And there might be other awards out there, but those would be your responsibility to find and apply for. Okay, so this is the link to the application website. The application is open now. The deadline to apply is January 8th. Everything except for transcripts is due at ORPAS by January 8th. That includes your references. So give your references lots of time to submit everything. You can log back into your ORPAS application after you've submitted it, and you can make sure that your transcripts have arrived after January 31st, that your references have arrived. And in February, you'll also be able to double check your GPA, and you'll be able to see the exact courses that ORPAS used to calculate your GPA. I really, really encourage you to double check that verification report, because that's your opportunity to fix mistakes. ORPAS is all work, like people work there, and they're the ones who are doing all the calculations, and people make mistakes. And I know if I see a mistake, I will let ORPAS know, I'll let the student know so it can be fixed. But I am literally one person reviewing thousands of transcripts, so you only have to review what you're submitting. So make sure that you do double check with ORPAS. Like I said, you log back into your application once you've submitted it, and make sure that everything looks right. Okay, so here's our contact information.